So, hello everyone, Karib Sana. This is Aisha Namgen from Uganda. I'm the Youth Country Coordinator for the Right Here, Right Now. Today is Monday, it's the 13th of the first Regional Linking and Learning event. This is the third event. I'm the host of the day. So today we should expect a few remarks at the start of the day. We are going to get to know each other. We are going to have a few remarks from the different colleagues from the embassy, from the Ugandan coalition, from the Kenyan coalition, but also we shall get to know each other as the day starts. We shall be able to interact with each other. So today the main theme for the day is inclusive sexuality education. We shall be taking note of what has we done so far, what is to be improved on. So for the second day we shall be having field visits with the Kenyan coalition. They shall be taking us around on what has been done, what they are doing. Okay, so for the third day we shall be taking stock of the different advocacy initiatives we've done, linking the different advocacy from the national, regional and international spaces. On the last day, we shall be talking about sustainability of the different outcomes. What have we done on the youth initiatives, on the sustainability of the different organizations and structures, among others. So feel free to enjoy the event. We are already here at Sarova and ready to start off the event. Thank you so much.
I am a project officer at Rhrn Uganda, and I am the project lead or the technical person in regards to programs at Rhrn for Right Here, Right Now. So I lead the program side. What I love about my space, I think I love the fact that ideas are very quick to become something. So it's very innovating, or like very invigorating actually. Yeah, it's very invigorating to see that an idea you thought about yesterday can become a big thing tomorrow.
Hello, my name is Dolaman Patinato. I am a project officer and a youth coordinator at the Center for the Study of Adolescence in Kenya, a partner in the Right Here, Right Now consortium here in Kenya. What we've done so far in this Right Here, Right Now program that we've been implementing for about 3 last years, we are in the 4th year right now. We've been advocating for the rights of adolescents and young people when it comes to sexual reproductive health, and also creating demand around the same. Over the years, what we've achieved so far, there are quite a number as a country. We've realized some steps ahead when it comes to young people in all their diversities enjoying their sexual reproductive health. We've done community interventions where we've trained intermediaries such as community rovers to provide comprehensive sexuality education to adolescents and young people in the community. We've also trained teachers to provide, as key intermediaries, to provide comprehensive sexuality educations in their institutions.
Hi everyone, my name is Mumina. I'm the Youth Country Coordinator for Right Here, Right Now program in Kenya, and this is day 2 of our Linking and Learning events. And today we are doing field visits. We're going to 3 different locations: a health facility, a grassroots community dialogue, and also a session that will be led by young people for other young people. And after the sessions, we're going to do a debrief and share our learnings. In the last session of the day, after the field visits, we are going to do a debrief with each other and share our learnings and what stood out for us across the 3 different countries and what we can take home, and basically just discuss key takeaways. Yes.
Then after lunch, we gathered to have two breakout sessions. One was with RNW Media on online advocacy and the oppositions that we could be facing there, how to tackle that, what kind of innovative mechanisms are we taking online for advocacy purposes. And then the other room was sharing some of the research that we have in different countries on dealing with opposition. So it was a panel discussion there. And afterwards, we gathered and we had a session about advocacy opportunities regionally, globally, and locally, and how to connect these three advocacy platforms. And afterwards, we had a very fun, healthy activism session, which was about how we can take care of our social, like our mental health, and what we should be doing around prioritizing tasks and making sure that everybody who's in the advocacy realm is in check, keeping their mental health in check. So this is all the sessions that we've had for day 3. It was very fun, interactive, and engaging, and I am glad I took a part of it as a host. Thank you.
Hi, my name is Olga Dafinamukuza, and I work in the SRHR Alliance Uganda as the country director. Today was very exciting because we were able to share very many different strategies on how the different organizations and the different members in the consortium are having advocacy initiatives and how well they are responding to the challenges from the opposition towards SRHR. What was key for me, what really came out for me, is the need for us to work together in partnerships, in consortiums, because sexual and reproductive health is now not safe. Everything is under attack, whether it is CSE, whether it is the sexual rights, everything is under attack. So it's important for us to work also together. What came out for me was the need for transformative communication. We need to be able to transform our communication to communicate very well to the people that we need to reach.
Hi, my name is Michelle Lachero. I work with Delegates Trust. I'm a program officer. Delegates is a digitization partner for Rhrn Now. Through program, we bring digital aspects into SRHR integration, either in information, education, or in the interventions that we carry out. So I was in Site 1, since Center 1. We met digital youth advocates and rovers who are young people who work with Nairobi's and CSA as implementing partners in the ground, not implementing partners like that, the lead champions who help do the work. So they mobilize groups of young people, they help implement, they do education, they do information sessions. So yesterday we met them in Nyali. They had mobilized a group of about 30 young people. The DYS led a session on sexual violence, what sexual violence is like, how the young people can identify sexual violence, pathways to report, ways to support victims.
So my name is Raymond. I'm from Kisumu County here in Kenya. So we are here in Mombasa for the linking and learning. That is the Anglophone countries, for where there are people from Ethiopia, there are people from Kenya, and also from Uganda. So I can use this information to talk to other young people on the ground, people from communities, from diverse regions, because the program is inclusive of all the people, the PWDs, the minority groups, and everybody.
Hello everyone, my name is Rhrn Anglophone. and I'm a youth advisory committee member from Uganda, working with Rhrn Uganda. We are here today for the lead on ranking and learning for Anglo and Francophone countries. I believe this has been a learning opportunity for me as a youth advocate or as an advocate for disability rights back in Uganda. We have had a lot to learn from countries like Kenya, from countries like Ethiopia, in terms of their intervention when it comes to sexual reproductive health and rights and inclusion of persons with disability. So I personally believe that we have been doing it as a country, Uganda, but from here I believe we have learned more tricks on how we can debunk on things like digitalization, on how to deal with the shrinking civic space. You all understand that in the recent past years we have had the civic space shrink, where we have had government come up with laws and policies that are anti-rights. For instance, back in Uganda we have the anti-homosexuality bill that has really made it hard for the LGBTQ community back in Uganda.
Hi, my name is Tesfai. I'm from Ethiopia. I'm the national coordinator for the Right Here Right Now program in Ethiopia. So in Ethiopia, we are implementing Right Here Right Now program starting from 2021. So we are remains almost 1.5 years in the program. So in Ethiopia, we had 4 partner organizations who are working on the Right Here Right Now program. One of the lead organization is Development Expert Center. The other one is TAYA, which is a youth focused organization. And the third one is the organization which is working on advocacy, and it's named ODOAS, Organization for the Development of Women and Children organization. And the other one is the main thing that we focused was disability inclusion. So we had a partner which works with young women with disabilities. So Ethiopian Women with Disability National Association. So in Ethiopia, we are working with the schools.
Right now, 2024.